Mental health care in England is a national emergency, says hospital bosses. We're going to read into this more from The Guardian, guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is REGANELITE here with an article from The Guardian with the headline that mental health care in England is a national emergency, says hospital bosses. Before I even read the article, I'm 100% in agreement. Mental health is so, mental health awareness is really important. You guys, I've covered talking about mental health, and I found this and I was like, I've got to cover this because this is a personal one to me, guys, and it's important to talk about these things. So let's talk about it. The NHS Confederation says mental health has slipped down priority lists and patients are being forgotten. Mental health care in England has become a national emergency, with overwhelmed services unable to cope with the big post-COVID surge in people needing help, NHS bosses said. Care is so stretched that thousands of people undergoing a mental health crisis are having to be admitted every year to acute hospitals, even though they are not set up to deal with them. Hospital bosses claim mental health in England has been forgotten by ministers who are given priority to tackling the record 7.7 million strong care backlog, access to GPs and ongoing NHS strikes. Mental health has slipped down the government's set of priorities and patients and services are being forgotten. This is a national emergency which is now having serious consequences across the board, not least for those patients in crisis, says Matthew Taylor, the Chief Executive of the NHS Confederation. Evidence the Confederation has collected from NHS Trust in England shows that some mental health patients are in such poor health that they have to be admitted to acute hospitals because they have no beds free in specialist psychiatric facilities for them or others to help available. People are coming to A&E having to wait very long periods of time either to be admitted or found the right package of care for those needs in the community, added Taylor. NHS leaders say this is now leading to thousands of patients being admitted to acute bed care where this may not be the right clinical setting for them and risk their mental health deteriorating further as a result. A historic lack of investment in community mental health facilities and places in supporting housing facilities, meaning there is simply nowhere else for people to be referred on to quickly enough, at which point the only viable option is admission to an acute bed, Taylor added. People in the midst of a mental health crisis are spending up to 50 hours stuck in A&E because NHS support for them outside hospitals is so limited, the Confederation said. However, hospital bosses voiced concerns that their doctors, nurses and staff are not well placed to respond to all the needs of people suffering from severe episodes of conditions like depression or psychotics because of their expenditure primarily in managing physical illness. One acute boss says we often reach a point where the whole health system agrees with the acute hospital is not the right place for the patient, but finding a better place is hugely challenging. The impact this has on the patients themselves, the staff caring for them and the other patients in the ward cannot be underestimated. The patient being physically cared for but their mental health condition is often not improving and may be deteriorating in the noisy environment of an acute hospital ward. The Confederation's intervention comes after NHS England's National Mental Health Director admits that services were severely understaffed and that psychiatric hospitals were very close to full at the time as a result of an unprecedented demand for care. A lot of services are still struggling with staffing, Claire Murdoch told the Health Service Journal. 1 in 5 health nursing posts are lying vacant. In addition, mental health trusts rely more heavily than any other area of NHS care on locum doctors, according to evidence collected by Manchester University and shared with the HSJ. Murdoch, who worked as a mental health nurse and runs a Mayor London Mental Health Trust, also said the long delays patients face accessing care meant that the treatment gap is too considerable. NHS England has delayed for 2 years the introduction of new waiting time targets in mental health care amid apprehension that staff shortages means they cannot be delivered. The Department of Health and Social Care spokesperson said, "We're transforming our country's mental health service and investing in an additional £3.5 2.3 billion annually to expand services to an extra 2 million people that can get support. The 2.3 billion pounds of funding was announced in 2019 before the pandemic, adding extra pressure to mental health services. Our workforce plan sets out an ambition to grow the mental health workforce by 73%, and in December 2022 there were 9,000 more mental health staff in the previous year, they said. But is it enough, guys? Is it enough? If they're saying it's a national emergency, then why are they saying it's a national emergency if they've said we've invested this amount. How many times have we heard this crap before, guys? I'm sorry, but it's just infuriating. Like, I'm sick to bloody death of them saying they've invested this, invested that, with no goddamn answer of how they're going to deal with this situation. Mental health is real, and people are breaking down because of the situation the country is in right now. More than ever, people are looking for help. And unfortunately, if you don't have money, you're buggered, pretty much. If you have money, you can go private, but obviously then it gives the government a reason to cut back on public funding because people have an alternative. And there are private firms out there who can help you with it, but obviously would rather not having to spend your own pocket in order to deal with it. But yes, this is it's not a physical health, but it is still a help that needs to be for people. And I just think the government doesn't care, saying that they've invested this and invested that, and you just don't know where that money goes. You really don't. They say it goes into the NHS. It doesn't. It doesn't, in my opinion. I don't think it does. I feel for those who are in a much worse state than I ever will be, because I'm nowhere near in the state of some of other people. That is for sure, guys. But it is heartbreaking to say the least. But what do you guys make of mental health care in England in particular? Are you surprised by this headline? Are you surprised that we're not doing enough? What more can be done? Should people turn to private healthcare if they can afford it? Let me know down in the comments below what you guys honestly think. Like, share and subscribe as always. Thank you very much for watching, and I hope to catch you all very, very soon.